Hi everyone, welcome to Dr. Taz, your medical expertise whenever you want. Please note that this is purely for educational purposes and not intended for a formal diagnosis or treatment. No medication or remedy should ever be given to anyone without consulting a doctor and checking for allergies first. Today's topic is psoriasis and how this is managed. Psoriasis is a chronic skin condition that causes red and crusty patches of skin with silvery scales. Psoriasis can appear anywhere on the body, and it is more common on elbows, knees, scalp and lower back. It affects men and women equally. It can start at any age, but it is more common in adults between 20 and 30 years old and between 50 and 60 years old. The symptoms can range from mild to severe, and there can be periods of no symptoms or flare-ups. The exact cause of psoriasis is not fully understood, and it is thought that it is caused by a problem with the immune system. There are other risk factors or triggers that can increase the risk of getting psoriasis, and these include genetics, injury to skin, throat infections, certain medications, smoking, and obesity. Psoriasis is not contagious, and it cannot be spread from person to person. The diagnosis is clinical, but in rare cases, a skin biopsy may be required. Psoriasis can cause psoriatic arthritis, and this can present with tenderness, pain and swelling in the joints and connective tissue. When this is suspected, blood tests and an X-ray may be required. There is currently no cure for psoriasis, but there are several treatments available to control the symptoms and to improve the skin. The common treatments for psoriasis are vitamin D analogues such as calcipotriene, corticosteroids, coal tar, anthralin, tazarotene, and a combination of corticosteroid and calcipotriene like Dovobet. Topical treatments come in the form of creams and ointments applied to the affected parts of the skin. There are several brands available over the counter without a prescription, and these can be tried first for mild psoriasis. If topical treatments do not work and for more severe cases of psoriasis, other treatment options can be considered such as phototherapy, oral or injected medications. Phototherapy involves exposing the skin to certain types of ultraviolet light, which is thought to be beneficial for psoriatic skin. There are two main types of specialized treatments for severe psoriasis. The first type is non-biological and usually given as oral tablets or capsules. The second type is called biological and usually given as injections. The non-biological medications include methotrexate, cyclosporin and acit-retin, and biological treatments are etanercept, adalimumab and infliximab. These are specialized treatments and can only be initiated by a dermatologist. If psoriasis is suspected, it is advisable to see a doctor or dermatologist in person for further assessment.